can advance with this
This
one. Not this one.
This one.
Yeah.
Okay, so after hearing so many different approaches to medicine, so many possibilities as we heard in these days, now I suggest to go back to basic medicine because I think that basic medicine is now pretty diseased, is ill, and we need really to start again to do good medicine, because to care for patients means to do good medicine. I mean, and good medicine means only one thing. I mean, to use the correct method that founded the Occidental medicine. As we will see, this has been a revolution, an incredible revolution in medicine. We all should be very familiar with the clinical method. That means accurate elicitation of symptoms and of patient's history. Accurate elicitation of signs. You have to examine the patient. You have to put your hands over. You have to do test, clinical test, in order to do the diagnosis. Diagnosis is the purpose, is the way that you can help the sick people. Does it work? And then you have to do the interpretation of symptoms and signs in terms of physiology and anatomy. That's the step that Occidental medicine put forward, that was not present before. And especially in neurology, you have to localize the vision, because otherwise you cannot suppose the nature of the disease. Like you have to be carefully and say, well, the problem is there, I mean. And the syndromic formulation, that means a number of diseases that can be considered for the diagnosis. This step corresponds to the anatomic diagnosis. So if you put together anatomic diagnosis, mode of onset and course of the disease, other medical data, appropriate, you have to ask for lab test and for the diagnostic exams according to the hypothesis that you can put forward. This allows pathological and etiological diagnosis. That is the best way to face the problem of the person. Choose, you have not finished yet. Choose the best treatment and obtain confirmation of the diagnosis through clinical follow-up and therapy effectiveness, or discuss diagnosis. Of course, the doubt must be always there, but has not to take away from you certainty, because otherwise the patient will immediately perceive this. Since the beginning of the examination, the physician should ask himself, what's the meaning? That is, what's the hidden unifying factor that allows us to understand all the events? Since the guy entered the door, the way that he's dressed, the way that he looks at you, and the way that he says hello, if everything is absolutely important. And you have to be really empathetic with medicine. Otherwise, medicine is really body. Yes, we end up to be burned out if you do not have this consideration of this great opportunity. Somebody is taking his life in the moment in which he's sick and is put it in your hand, and so you have to appreciate this and try to do the best that you can to answer his needs. The diagnosis is always discovering. You don't know it before. The first time that the guy enters, so it is not, cannot be already written. It's not there is not the algorithm. And I think there will never be us. We see. And sometimes it happens to me for strange cases that at a certain point the diagnosis becomes clear for you. And you say to yourself, why didn't I think it before? And all the data were there, but you need something else, more, intuition, experience. What kind of knowledge is clinical experience? Well, it's something that is not a scientific process. It's, to collect all the symptoms, the signs, and see which is the direction. The diagnosis is the direction of all the signs. Is the way you can interpret best all what is happening. And remember that you are not omnipotent, so maybe you'll never be able to do a certain diagnosis, even at the autopsies. And the adventure to know better the diseases and to it's never end. At the end of my career as a neurologist, I took over the ambulatory for ALS stations. Was nobody wanted to do it, and really each case of ALS is discussed on the art. It's incredible. The more that you look into, the more that you discover that each patient has a different disease on him and needs something else, something different. Well, probably you are familiar with this, Michel Foucault, who wrote books about clinical medicine and the revolution in understanding in societies that this has brought about. Who discovered the clinical method? And Italian.
Well, if you go to France, they say it's not crazy. But
the book is there. The book is De sedibus et causis morborum per anatome indagare. That's the beginning of the clinical method. Bogani studied in Bologna and had to go away from Bologna because in Bologna was thinking that the best way to face diseases were a very accurate description of symptoms and signs and classification. And he said that to say, no, because you have to go deeper. You have to go where the problem is, which is the organ that is affected. And it was finding this. He had to go away from Bologna and became the anatomic professor in Pau. In such a method, where does the observation experience integrate with the progress of scientific knowledge and biological science? Because, of course, a method is true if it takes care of all the facts. So if you have a new discovery from a biological point of view, the method would be able to take on this. It is called etiophysiopathology. That means you have to go deeper through all the discovery of science or the biology and medicine, and through the tools that the criminological science offers you to understand better the cause and the way the damage is done. Okay, and in my opinion, I don't know here in Canada, I passed Manuela this morning, but I don't know which is the perception by people of the in medicine, of the health system in Italy is really badly put as bad. The impression is that the system does not answer the needs of the people. The system is such that to get an animal, you need to wait for 8 months. To get, even with the system, and a neurological examination, 2 months. So there is no answer to it. So if you need something urgent, you have to pay for it. And we have a very high taxes load in Italy, so Okay, the clinical method was remained unchallenged in the 90s. But there was a period in which a change happened in medicine. That was the introduction of epidemiological method in order to study disease. Epidemiology since in the 60s was just applied to vaccination, to infectious diseases. But at that time, much more money went to the medicine, and so the longitudinal studies started. So they started to study medicine from an epidemiological point of view. There was a lot of emphasis on the work, disease, and at a certain point, almost each disease could be done by pollution, by bad mental. Instead, now we know that very few diseases are due to contaminant, to toxic, and to pollution. And of course, epidemiology has given the understanding of diseases, because now we know statistics about incidence, prevalence, which are the most consequent symptoms at the beginning of the disease, which are the one that appears later. But all those notions are useful inside the clinical method. At the beginning of the 90s, there was a big revolution in, as you know, that is the introduction on evidence-based medicine. Evidence-based medicine was introduced for a necessity. At that time, the scientific literature grew up in an incredible rate. It's impossible for a single medical doctor to keep up with being updated. And so the people decided, in a Canadian circuit, decided to meet together with epidemiologists, statisticians, and specialists of different branches, and to do a review, a meta-analysis, in order to get the core of the advance in medicine. David Lawrence Sackett was clearly aware that the best medicine was a combination of good clinical experience and the bold discoveries of evidence-based medicine. Sackett, when he was already a full professor of epidemiology, decided to repeat internal medicine residency to refresh his clinical experience. He was at that time in London, and in the article, The Science of the Art of the Clinical Examination, think about the title of this, our meeting, in 92, was writing, our first moment with a patient is rich in visual, auditory, and tactile information that determines both the effectiveness and the costs of our subsequent care. Costs. Of all diagnoses made, most are defined during the medical history, and most of the remaining ones during the patient's physical examination. It has been documented that 88% of diagnosis of right diagnosis in primary care were established by the end of a brief history and some brief clinical examination. This is what does not happen anymore, because when you see a patient as a specialist or as maybe a family doctor, you ask for exams usually. However, the application of such a methodology has raised questions about the scientificity nature of many medical and surgical practices, if not of all. So a counter was put there that clinical method is not scientific. For example, at that time of the evidence-based medicine, the treatment by optical device of myasthenia was completely assessed.
but it was not done with the evidence-based medicine. So there were doctors then
To doubt about the scientific of this scientific method is unnecessary if you have myasthenia that produces 60% of that, and then you use a corticosteroid that drops down to 5 because of postdoctor Robert B6. Because if you treat very well the disease, there is no therapy.
So you have an idea of what is going on in the mentality. It has become clear that medicine as such, that is the method, the clinical method we are talking about, cannot be completely assimilated to the scientific evidence sought by evidence-based medicine. And this has sown seeds of doubts about its scientific basis. And the way the diseases are described has changed. Before, physiopathology was the core of because it's a great character for the doctor to interpret the science. But the diagnosis is ideally reduced to a comparison between lists of signs and symptoms and their prevalence in various diseases.
And of course, in AI could be much better than us.
Because it can keep in mind all the diseases. In
psychiatry of the case, genetic diseases are narrow around 2,000.
So how can you know all the clinical picture of those? Moreover, the weight and value of diagnostic tests, which are also called objective in quote, in contrast with the subjectivity of the clinical method, are totally changed. In fact, today doctors tend to expect the diagnosis from these tests. And that's, I don't know if you understand, but that's
the different way to think, in my opinion, is to renounce to think. Because if I have to do whatever to do the diagnosis.
Cannot just think that NMR will give me the diagnosis. Several diagnostic test specialists became the
depository of the diagnostic capacity.
For example, in neurology, electroencephalography, Doppler ultrasound, electromyography, vestibology, the exam of the vestibulum, and neuro-ophthalmologist, and especially the radiologist.
I used to talk with my radiologist. The radiologist would say,
what are you doing still the neurologist? I'm the one can see this. You don't know anything. You don't understand anything because you don't have the experience. Think about the fact that 30% of the patients that go to a to see a neurologist
is a functional patient, that there is no organic disease there.
So what's the usefulness of NMR? Nothing, not much more matter.
Much worse. NMR will show some occasional finding that will take you from another way that does not cure the patient.
But even the NMR is interpreted by a doctor, so it's not objective. And I don't see why the medical interpretation of a brain NMR should be any more objective than a clinical examination of the patient.
If I examine a patient as well as those subsciatic disease,
if I find that there is a radiculopathy, I know exactly the point in which there is the compression and irritation of the root.
It's completely objective. MRI. From this comes a mentality that produces diagnostic therapeutic flowcharts, protocols, and so on. I was asking my student
Is it a flowchart, a diagnostic flowchart useful for diagnosis? And then what it was say, of course, but that's, are you crazy? Flowchart is not that of any help in find the diagnosis. It's very good in verifying the diagnosis. Once you make the hypothesis, then you follow the flowchart and will be more certain at the end of that. No? But you get to consider that.
Flowchart, diagnostic flowchart is a misunderstanding name, I mean.
The idea is that physician
Who see patients should be only technician, executor of procedures. Well, what Kleiman clearly said that in AI is the idea that we is substituted by
technician, by AI that will take care of medical health. In principle,
I'm not against the fact that in patient go to see it on Google because the patient has a great advantage compared with us that they know very well to disease the experience. So experience, it's a knowledge that is much deeper than theoretical knowledge. But then at the end they had to another deal. A guy he came by institute by the outpatient center, and he said, well, I've been examined by so many, but I saw on Google and I think I got a myasthenia. So I said, oh no, we'll see. The other he said, you are right, you have a myasthenia. And of course, then he has to go to it because they have to take care of treatment, of the.
All responsibility is offloaded to the physician after having removed from the only tool that actually works.
So no wonder that so many medical doctors try to do not take responsibility. Because medical, a clever method means that you take responsibility of the diagnosis. And he said it's much easier to send it to another person, another physician, that we hope that he will take responsibility. This happens with only doctors, but this happens with specialists. And in the test system, because of the rotation, you always ask for another exam, and you hope that the guy will be seen by another doctor. I have had people who for 4 years were going around to Italy with all the best neurologists and with exams, and that was absolutely clear that he had ALS, and nobody told him that ALS. No, he wanted to take responsibility for this.
Nowadays, defensive medicine.
Nowadays, in front of the patient, nowadays the physician is not concentrated on trying to find the right diagnosis because he is in fear of being sued, and he worries about defending himself. This fact heavily interferes with the clinical method and tends to disrupt it and to not to take responsibility. Instead, the clinical method is the best way to defend oneself because patients understand immediately if you are taking care, taking responsibility in treating them, take them in charge. One of the best things that you can say, especially to, for example, psychiatric diseases, is to tell, well, there is a way that you can be killed, and we do a work together. I will see you. We see the things that don't work and don't be a prayer, and that's absolutely important, and it's clearly there that somebody
tell them in this way. And then the pharmaceutical
company policy. Now, probably in the US, we already faced this with the introduction of the antibody, monoclonal antibody for Alzheimer's disease. Yeah, it's really, I mean, not talking about cost, but it will be just a first. So every 2 weeks, people will come in with a good idea, the antibody ED, and then have animal, you have the test, and you have all the exams, you will answer.
This is really, in my opinion, very dangerous. I mean, very. The ideal in outpatients is to pass to another guy, and in ER
Is the same. The doctor that is in charge asks for specialist opinion, hope he does makes the diagnosis and will take to hospital
the person. In Italy, at least, committees that are necessary to evaluate driving license, aptitude, ability to work, family physicians always ask a specialist to take responsibility.
Even always talking with this people and saying, but if they do not take responsibility, what are they there for? If I say, well, you are able to drive, and the biologist, why do you need a committee? Yeah.
How to get out from this? Well, as Kleinman said it, we have again to claim that the center of medicine is this method.
Well, why didn't we counted the way that the old resident tasted the young one saying and were completely honest? I mean, that's that the chief would be able to set the weight in on the person. It's a very critical matter. If you don't do a good analysis, then problems will start because everything will be much more confused. Let's do an example. Low back pain. Almost everybody we thought of low back pain, and what Klein or Corfini said that if they go to the epidemiologist, unaided and got better it's true. But why? Because do you still witness that you are facing in it? If you go to a neurologist or orthopedics, they do not examine you. They just ask for another for the MR. And really, I was telling the students, what exam would you like to make for a low back pain, simple low back pain without fair? And why? Because it shows me also soft tissues, everything, so it's much more important issue. You are completely wrong, because which is the position of the patient in MRI is a clinostopism. So it doesn't inform you about postures. Bad posture is the cause 90% of low back pain. So see what cases. X-ray as a put also in obliquus and in dynamic, so got information, and it's the best way to do it. But think about first, if you most of you are oncologists and need exams because you have to stage but if you have all those exams, hernia, this hernia is the cause of data in 12%. So in the 88% of the data is useless, not diffuse, is dangerous. It will then shows you the idea hernia that doesn't produce anything, and you would also find a surgeon that will progress. And then you have the consequences. And if you execute a patient, you can know almost every kind, exactly the situation.
if no radiculopathy is there, it's useless to do an EPA. And if you find a radiculopathy and that the sciatica lasted for 1 week, you have to wait, because usually inside between 1 and 2 months, it resolves very sad, because earlier become tropic. So enema is independent only if you have to send it to the surgeon.
But this is also
Worse, ferritin, with vasovagal syndrome. Every physician knows very well that syndrome is not a disease. It's a way of effect of the brain. If the flux, the blood flux is not enough in my brain, then the brain causes pain. And if you go to a neurologist, almost invariably now in Italy, they will ask for MRI, EEG, color supportive. Because the diagnosis is there. If you listen to the patient, especially if somebody was there, heard from the patient, you know exactly what. No, but most of the safety now are caused by physicians. That if excess antihypertensives keep happening. It is really.
well. But why this happened? Why this happened? That's, in my opinion, is the most important part. I mean, a huge and hidden revolution in understanding intelligence has happened. Computer science, artificial intelligence. I do not have time to go through what happened in the last century through behaviorism, cognitivism, and now we are. I found this Dreyfus critique of all this really enlightening. The most radical in this book that was published in 1972, so much before even PC were working. I mean, what computers cannot do, the limits of artificial intelligence. And Dreyfus offers a critique at the basis, the very basis of this understanding of intelligence. What distinguishes men from computers, even though both are designed in an intelligent way, is not an abstract universal immaterial soul, but a concrete, specific material body that implies, yes, as a lot of, cannot go, of course. If the computer's paradigm becomes so strong that men begin to think of themselves as if they were digital devices made on the model of artificial intelligence machines, then, since machines cannot be like humans, on the grounds that we have shown, that Dreyfus has shown, humans can gradually become like a machine. And this is the, in my opinion, the prophecy that is realizing in our society. The risk is not the advent of the super intelligent computer, as all the movies of the showed, but of intellectually underdeveloped human beings.
And I think that there is a great unexpected possibilities in climate study in the application of AI, because human beings are lazy. And that's the best characteristic that is really to think about, to engage yourself, it's fatigue. And so if you offer a way to not to confront reality, then may will take very. And this is, so if you have an AI for the diagnosis, you become more and more incapable of finding the diagnosis, of using the method, clinical method. Clinical method has the characteristic that if you apply it, you learn from experience. Even if you do not have an asset that teaches you, of course, if you can, it is much better and much
speedy, but
I don't know if you are familiar with this. This was the cartoon with which in Europe gave 10 very lot of money for the human project. When the idea was to reproduce the brain and the intelligence and
starting from a computer point of view. Then, of course, the last part was dropped because there were criticism, but the idea is this one.
will medicine survive the loss of the clinical method? The answer, in my opinion, is no. It's impossible, because otherwise everything it becomes complicated. Yeah. One of the field in which now there is a lot of confusion is exactly the field of the physical, functional disturbances. It's keeping on in an incredible way, and it's faced not in the right way the mirror.
But the problem is much larger. Will human life survive the waiver to use the human mind according to all its openness and to all its possibility and capabilities?
Well, the world in which we are makes it a problem. And
we have to defend the right use of reason in front of madness that is going on at all levels.
But fortunately, nature, the flesh, bones, viscera, the cells, water, especially especially brain and neurons, becomes a need for the infinite in the human being, for the meaning of things, for understanding relationships and the unifying factor of things, for grasping the infinity within language, mathematics, music, are examples of infinity. We are made, or our physiology is made for it. As you know, our brain is predisposed for language. It's predisposed for music, and it's predisposed for mathematics. And those are infinite.
Unlike animals, even our physiology is all set with this opening to infinity. This opening to infinity is rooted in our humanity, and is thus ineradicable. The problem is not, in my opinion, to humanize technological medicine, because it can be very equivocal that you have to add something. The problem is to practice a good medicine updated with all the biological discoveries and with all technological tools.
I use AI, but in the right way. A good medicine means one thing only, the clinical method. Those are the mountains nearby all, where I go in see by